Hi, this is Dr. Saxena, and in our series we are talking about some. I got a good kind of one of my senior as well as friend who is not into medical kind of stuff, but he always tries to understand what is happening with the day to day things. And yes, he said what you can do for this thing called osteoarthritis, meaning a 50 plus person, and needless to say, he must have tried every other painkillers and all that, supplements. And let's discuss on thing what is this thing called osteoarthritis. Uh, when we talk about this osteoarthritis, suddenly we just think of only the knee joints, and we imagine someone very frail, old, and elderly person having this. But on the contrary, we are seeing more and more young individuals also getting into that, and we'll discuss how we can always change this paradigm shift, and why people who used to get only during the later part of the life, now we are getting into early, it's a quite early onset. We are talking about this osteoarthritis, which is a localized inflammation, possibly with crippling consequences. Um, um, by the age of 70, almost more than 70% of people, they get afflicted with osteoarthritis. This is a very common thing. Um, Again, this is one of the leading cause of the disability, and still we are as a kind thing working on this. But I will try to put you what are the simple steps which you can work it out, where you can always see how best you can avoid it or minimize the thing. Um, Coming to cause of osteoarthritis is not known. It is secondary to some injury or repetitive joint use or conditions such as obesity. Contrary to what many people believe, osteoarthritis is not a part of normal aging. I just want to send you this message. It is not a part of normal aging. It's it's a disease that should be treated aggressively at the earliest symptoms. We need not wait. So there are reasons, possible reasons. Whenever we used to go with the mild osteoarthritis, we were told, no, you can ignore that and this thing, you can avoid strenuous activity and all. As a doctors, we must have told a lot of people. Uh, what next? What is now we are very sure we don't want to give this painkillers and all because of the prescription related problems what we are getting. And again, I can always tell you the search for a drug that is a magic bullet continues, and there are there is a wealth of data with the natural value of natural therapies to treat this osteoarthritis. And I believe natural anti-inflammatories should be tried first, reducing they work by reducing the swelling, they work by reducing the pain. Apart from that, while the other nutrients supply the underlying building blocks of joints and reduce the oxidative damage caused by the loss of joint cartilage. Um, um, we have here, I just want to tell you, I'm not talking about rheumatoid arthritis or asymmetrical arthritis, so this is a separate segment. What we understand when, as a radiologist, I used to see a lot of X-rays, and I used to tell, oh, this is a bone on bone, and this is absolutely, there is no space left, and you need to go for the surgical this one. What happens here in osteoarthritis? The thin layer of cartilage between the joints gradually erodes and wears away. So as this protective layer of cartilage vanishes, the bone beneath becomes pitted and uneven. This is our understanding, and the structural integrity of the joint is destroyed. So what happens is the movement becomes extremely painful, And in the worst cases, people who are having severe arthritis, they are not able to do day-to-day activities. So on this context, in the normal joint, what happens is the ends of the joining bones are covered by a smooth cartilage that offers little friction, right? The whole joint is covered with a special tissue called synovial tissue, which secretes synovial fluid, and this synovial fluid lubricates the cartilage and ensures the joint continues to function smoothly. So this is the normal thing, which is called the cartilage is a firm gel-like substance which acts as a shock absorber. That's the kind of so when we don't have that cartilage, what are the things you can always I don't want to there are some things we try to work on this is late I would like to give you the early things what you can work it out at your level. This particular the cells that synthesize the collagen and the proteoglycans which comprise the cartilage, they cease to function during osteoarthritis. So over the time, this cartilage becomes to retain water and swell and becomes soft and eventually cracking. And next, tiny cavities form in the bone beneath the cartilage. We can see that in the radiographs as well. The bone may overgrow the edges of the joint, which are called osteophytes in our X-ray terminology, that restricts the movement. So this final stages, the cartilage becomes rough and pitted. The symptomatology was how the patient comes aching joint pain aggravated by use, advanced osteoarthritis, you have got pain may interfere with the sleep also. In some patients, synovitis or inflammation may cause. There are some things we would like to restrict things at the early things here. So, what is the early approach to osteoarthritis, which as an integrative physician, I am trying to look, having worked with a nutritional medicine for a quite long time. Even the textbooks and conventional textbooks recommend the people with osteoarthritis consume a diet rich of anti-inflammatory, antioxidant as well as joint supporting nutrients, and avoid eating something like pro-inflammatory foods which are high in sugar, saturated fats and trans fatty acids. Been talking to several kind of things. You need to increase the omega-3 fatty acid, reduce the omega-6 one. Omega-3 is high levels are found in fish oil, high levels are found in flaxseed oil. You need to work on this. Omega-6 are usually sunflower oil, refined sunflower oil and safflower oil and other stuff. You need to see that you limit that particular thing. There is a thing called avocado oil which was a basically unsaponifiable fatty acid, and it is sold as a drug for osteoarthritis. We are talking about in the place we live with our country, which is we get lots of curcumin. Curcumin is a component of the turmeric and it's a very good anti-inflammatory compound that inhibits both the COX-2 and COX lipoxygenase enzyme activity. There are a lot of papers which was presented. Capsicum with red pepper and curcumin found they are found to decrease the pro-inflammatory cytokines here. Curcumin. The second thing which comes to my mind is ginger. Ginger is one of the, in Ayurveda it is called as a Maha Aushadhi, and I'm a big fan of ginger. And people can start using ginger as a chewing gum. They can just keep in the mouth ginger for a small piece, and we traditionally take ginger along with the tea here, and ginger is found in every food. Ginger chicken and ginger in any vegetable is a must in Indian kitchens. Ginger is the other one I just want to talk. There is something like nettle leaf tea, you can always go for it. There are some other things which you have to understand. This is most of us do understand, which is called glucosamine and all that. These are free of side effects. It's a naturally occurring substance, and it is synthesized by chondrocytes for the purpose of joint cartilage. And glucosamine synthesis is defective, and supplementation with glucosamine has proved very useful in terms of osteoarthritis. Chondroitin sulfate similarly is very useful. People have used for prevention. I believe in something called sulfur. Sulfur is the most shown. Animal studies have shown that the joints affected by osteoarthritis have low sulfur content. Arthritic mice given sulfur containing nutrient MSM experience less joint degeneration. This is a food for thought. And MSM we have used in a lot of things in osteoarthritis cases. I am just talking about initial stages. I'm not. This is not as a medical prescription. You need to look at your things. What is at what stage, and you should always reach a doctor and look at what are the options available. But I can certainly tell you, the early you start this process, you're not going to get into the severe stage. Green tea extracts, we have been using green tea extracts for, it's basically a polyphenol, epigalactocatechin. It is called EGCG, used in cancer, used in a lot of stuff, and it is one of the good things. And apart from that, we ask people to go for a lot of other antioxidants and all that, whatever is available with them, like vitamin E, vitamin C, something like glutathione and N-acetylcysteine. So this is our approach, and yes, I do believe this is one of the things which can be easily correctable, and can be apart from that, I would like to understand the two concepts I just want to tell you is identify and avoid food allergens for you. The food allergens are one of the important thing, and apart from that, treat support digestion and treat the leaky gut syndrome. Leaky gut syndrome is one thing which I had been telling for a while now, and you need to look into this particular stuff. So you need, once you treat your leaky gut, your gut heals and you start getting better. We try to use most of the natural anti-inflammatory things. MSM works like a thing. Sometimes niacinamide, which is a vitamin B3, we try to use it for this particular stuff. We try to use a lot of bromelain also. Ginger, curcumin, I already told. There is a thing called Boswellia. Boswellia is an Ayurvedic drug, and I somewhere believe this has got a very good anti-inflammatory role. Apart from that, you have got some fatty acids, which are evening primrose oil, something like cod liver oil, vitamin E, lipoic acid. I depend a lot on my practice. I try to use this transdermal magnesium, and it really helps. The moment somebody is hooked on transdermal magnesium, it gives it's again it is helping indirectly. And apart from that, you need to always do that, keep daily exercise, keep muscles around the diseased joints strong, and decrease the need for anti-inflammatory. So you need to do knees, you do straight leg lifts and knee extension exercise, and to strengthen the quadriceps, gentle resistive exercises are enough. You don't have to go. The other thing which we do is called Prolotherapy, which is injecting something hypertonic, something into the ligaments and tendons, and this is one of the proven things which are it's mostly used by alternative medicine doctors, and we try to work on something like PRP, stem cell therapy, and this is how we are trying to work it out. And yes, there are some things which has to be properly worked out. I believe if we can work on this diet part and all that in a proper way, things will be much easier. That's all for this and osteoarthritis, and thanks